Hi, my name is Chento. I'm one of your favorite Osce trainers here in the UK. I come your way once again with yet another exciting update about the Osce. As part of your 10 station that you need to take during your Osce test in a span of 2 to 3 hours on your test day, you need to do the API, which consists of 4. That is assessment, planning, implementation, and evaluation. For those doing adult nursing. For those of us doing the nursing associate, you need to do assessment, implementation, and evaluation. And then you do 5 clinical skills for nursing associate. And then for those doing adult nursing, you do 4 clinical skills. And then both of you do 1 evidence-based and 1 professional value. Among that 4 or 5 clinical skills in Osce, there's this particular skill called oxygen therapy. That is what we are going to talk about this time around. So if you are preparing towards your Osce, please come closer. Make sure you like, share this video, and follow us for more updates. So oxygen therapy over the years has been one of the clinical skills in Osce. It's treated as a hospital-based scenario. So during this station, you'll be given a flipping pages of prescription, just like the implementation, and your job is to do justice to it. So you'll find prescription of oxygen administration at the prescribed oxygen section of the medication administration chart. Over the years, it has been the usage of different delivery device. For the past 2-3 years, it has always been the reservoir mask. Recently, the NMC has updated the marking criteria, and they are also introducing different delivery devices on the test date. You may meet the reservoir mask, you may meet the nasal cannula, you may also meet the venturi. So whichever delivery device you meet, that will be stated in your prescription. So make sure you read the oxygen therapy prescription from the first page of the medication administration chart to the last page. In the middle of it, you would find the oxygen therapy prescription. Make sure you read it thoroughly, and then you get to know the right device. Okay, so you may have the reservoir mask, which has its code as RM on the prescription. So it will come in 8-pack. Please, you make sure you validate it, stating the expiry date, batch number, and stating that whether it is safe, intact, and you are happy to use it. You validate it, and then you are good to go. So this is the reservoir mask, and once you connect it to the oxygen, either the wall one or the portable one, you need to turn it to the required flow rate, which will also be stated in the prescription. Once you turn it to the 15 liters per minute as per prescription, you place your finger. You will be in your gloves. Don't forget about that. So you place your finger on this one-way valve, making sure this reservoir bag is fully inflated, and then you can immediately fix it on patient's face, making sure it covers the nose and then the mouth. If you don't meet the reservoir mask, you may also meet the venturi. So with the venturi, you have the mask, and then you'd also need one special item, which is called the valve. So with the venturi, it has different valves. We have the yellow, the red, the blue, the green, and the white as well. And each of them have a special delivery amount of oxygen. So this one is venturi 35%, which is required to deliver 8 liters of oxygen per minute. So if your prescription says take venturi 35%, then this is what you are going for. Please read your prescription so that you know the type of valve you would choose when the delivery device is venturi. If you don't read the prescription, then you are not going to know which of the valves you are to select. Remember, we have different types of the valve: the white, the green, the red, the blue, the yellow. This yellow one is venturi 35%, 8 liters per minute. And Just as I said earlier, this will be stated in the prescription, so don't worry about that. And then you may also meet this traditional one that we all know, the nasal cannula, which also has delivery code as what? Capital N. Good. So the reservoir mass is RM, ventry is V, and then they will add the percentage to it, and then nasal cannula is what? N. Read your prescription to know the type of delivery device you are required to use during your oxygen therapy administration station in Osce. With the nasal cannula, after connecting it using aseptic non-tack technique to the oxygen, then you turn it to the required flow rate. So this device is normally expected to deliver up to about 5 liters of oxygen per minute. So as per your prescription, you obey accordingly. So let's say the prescription says administer 4 liters of oxygen using the nasal cannula. After connecting it, you turn the flow rate to what? 4 liters. And then with your gloved hand, you place it at the opening of the prongs to feel the flow of what? Oxygen or air, before you fix the 3 types of delivery device you may meet in your Osce when it comes to oxygen therapy: the reservoir mass, the ventry, or the nasal cannula. Whichever that comes, make sure you read your prescription, understand the prescription, so that you know the type of delivery device to use. Until then, all the best.